mitral valve is one of the most important valves in the heart. It's the valve that separates the main squeezing chamber of the heart from the lung circulation. And it's very common in society. I think something on the order of 10% of all patients above age 70 will have had some important or significant issue with their mitral valve in their lifetime once they reach that age or once they progress beyond that. Patients who have mitral valve leaking, especially, they have a problem with being short of breath when they're active. And that's because blood that's supposed to be going forward, pumped out to the rest of your organs in your body, is going backwards towards the lungs, and that makes the lungs congested. So the typical symptoms somebody would have with mitral valve leaking are that they'd feel short of breath when they exercise. Sometimes it leads to heart rhythm disturbances like atrial fibrillation, but it can also lead to heart failure, and at a particular degree of leaking, when it's severe, that begins to be associated with what we call adverse cardiac events, higher risk of heart failure, hospitalization, stroke, and death. It's something that you can't really leave alone, especially when it becomes symptomatic. In order to fix a mitral valve that's leaking, you can either replace it with a tissue valve like a cow valve or a pig valve, or even a metal valve, or you can repair it. And it turns out that the initial therapy that we had for this was valve replacement back in the day. And there was a time where some really smart docs started talking about mitral valve repair because it made some sense to be able to try to do something to the mitral valve leaflets. These are kind of robust tissue that you can typically put stitches in and things like that. And in the 1980s, it was found that leaflet repair techniques, with the addition of something called an annuloplasty, which is stabilizing the base of the repaired valve with an implantable ring, turned out to become a very durable procedure, and so much so that over many years of study and statistical analysis, it was found that if you have a mitral valve repair, you will live longer than people who have mitral valve replacement. Mitral valve replacements are often going to fail over time, especially a tissue valve in the mitral valve position is going to last on the order of somewhere around 10 years would be a really nice amount of time for a tissue valve to last in the mitral position. And if you have a metal valve replacement as a young person, those valves are purported to potentially last somebody their entire lifetime, but they also come with the morbidity of having to be on heavy-duty anticoagulants with about I think it's about a 1% chance per year of either a significant bleeding or clotting event, and that accumulates over that person's lifetime. There are very few surgeons in the United States who fix a broad range of mitral valve leaking because the mitral valve can leak based on a number of different mechanisms. Most younger surgeons will have been taught in residency and fellowship how to fix the more common types of mitral valve leaking, but the more complicated types of valve leaking are rarely repaired, but that's something that we now specialize in at Vassar Brothers Medical Center. And so the short answer is a good valve repair is definitely better than a valve replacement.